Hi, I'm Dr. David Draughn. I'm the owner and CEO of Vein Specialist of the Carolinas. Today we're going to talk about some of the very basics of venous disease. Vein disease is when your veins just don't empty properly. So the veins carry the blood from the tissues back to the heart. The problem is that the pumping pressure generated by the heart is not really transmitted very well through the capillaries, and very little pressure is left over. So the veins have to rely on the pumping action of the muscles and one-way valves to get the blood back to the heart, particularly when you're sitting up or standing. When you're lying down, those things aren't really required. However, the underlying cause of this is mostly genetics. It's almost an autosomal dominant transmission. So if one parent has vein disease, you have about a 50% chance of getting it, and if both parents have vein problems, you have about a 100% chance of having vein problems yourself. Besides genetics, there are some minor things that contribute to the increased prevalence of vein disease. Age is one, female gender is one, weight is one, standing or sitting for prolonged periods of time is another minor contributor. Physicians, we can classify vein disease according to several stages. The first stage is when you just have the presence of visible veins that are abnormal at the surface, like varicose or spider veins. Now, if those begin to hurt or cause symptoms, aching and heaviness, that becomes stage 2. Stage 3 is when your leg develops swelling. Stage 4 is when the skin changes below the calf, where the leg starts turning brown and the skin gets thicker and redder and tougher. Stage 5 is when you've had a venous ulcer, but it's healed back up. And stage 6 is the last stage, and that's when you actually do have a venous leg ulcer or a non-healing wound on your lower leg. Left untreated, vein disease will not improve on its own. It's a gradually, slowly progressive worsening situation. You can still have vein disease even if you don't have visible spider or varicose veins. Leg swelling can be caused by vein problems, leg heaviness, aching, cramping, restlessness, itching. Itching is a very common problem with veins, and most people think it's some type of allergic reaction. All of those are symptoms that are typical of vein disease. The current treatment for venous disease is very, very effective. It's not universally 100% effective in every single patient, but the vast, overwhelming majority get tremendous relief of their symptoms. Insurance does cover the treatment of venous disease for most patients. Some things that are important that you may have to do is you may have to wear compression garments for a period of time. You also will need to have a venous leg ultrasound that demonstrates venous reflux in some of the major veins. Most cosmetic vein issues are from spider veins. Those can usually be treated easily with a procedure called sclerotherapy, where we just simply inject a liquid or foam solution into the vein, and it chemically damages the lining of the vein. The little tiny veins clot, and then over the next 6 weeks, everything gets absorbed and goes away. Insurance will not cover cosmetic treatment of veins. So for insurance to cover, you have to have symptoms. The symptoms have to interfere with activities of your daily living. You have to have venous reflux on an ultrasound, and then that's when insurance will cover. Today, nearly everything we do to the venous system can be done through a small nick or a needle puncture. Patients actually walk in, have their procedures, and walk out. Thanks for letting me have the opportunity to educate you a little bit about vein disease. Again, this is Dr. David Draughn at Vein Specialist of the Carolinas. All we do is veins, all day, every day.